Why is atrial fibrillation with a rapid ventricular rate more concerning than atrial fibrillation with rate control?
So in general, when they're trying to manage a person with atrial fibrillation, the goal is to get them into the normal sinus rhythm as soon as possible. That's not always achievable. That could be that they have enough structural change in their atria that they can't re-achieve the normal conduction pathway. But if they can at least get them down to rate control, i.e. less than 110 beats per minute at rest, and they can have a rate increase with exercise, but as long as they resume a resting below 110 and they have an appropriate blood pressure response, that they're increasing their blood pressure with exercise, that would tell you that this individual is tolerating the exercise, is in stable A-Fib, is a person who is okay to exercise but needs their blood pressure measured to make sure that they're tolerating the exercise in spite of their A-Fib.
Would you, do you have a recommended maximum heart rate for when they're active?
At that point, it's harder to say because it's not necessarily a strict Carbonin formula.
Right.
You know, you have a little more variables. So
Sure.
It might be that you let them increase with exercise, but you don't make them sustain.
Okay.
And you give them that time to see if they can come back. You know, I don't think there's real hard, fast rules on that one yet. If there ever will be, I don't know. But I think anytime you're dealing with a person who has at least one diagnosis, if not a whole stellate of comorbidities, you're kind of giving them incremental challenges to best define what variable was the most challenging to them. Because so often in their everyday, they're just getting tasks done. And they might be pushing themselves beyond what you would with all the fancy monitors you put on them. Sometimes we look at people like, how long has this been going on? Is it just a problem because now we have an identified picture of it? Or is it a new problem? You know, there's always that tussle we have with ourselves too.
Right. So it seems like at least with the monitoring the blood pressure, you have a gauge with the activity that's helpful to
know that, you know, that it's an appropriate increase, or that it's an increase that you would expect versus a drop in blood pressure, which would imply that they are not meeting the cardiac output.
They're not tolerating it.
And they're falling behind.